Question 1. A surgical team requests an immediate turnaround for a dropped specialized retractor. The sterile processing technician runs it through an immediate use steam sterilization (IUSS) cycle. What is the correct protocol regarding the cycle documentation? A. Retain only the physical printout until the surgery concludes. B. Log the complete cycle parameters, patient traceability, and physical monitor results. C. Skip the biological monitoring record since IUSS bypasses terminal storage. D. Document the cycle only if an implantable device is included in the load. Correct answer B. Knowledge point explanation. Core rationale. Complete sterilization documentation is universally required for immediate use steam sterilization, IUSS, identical to terminal sterilization. This includes cycle monitoring, physical, chemical, and biological, and patient traceability to ensure safety and quality control. Trap analysis. Option A is incorrect because retaining only physical printouts neglects patient traceability. This action is correct only if physical parameters are the sole focus of a temporary sterilizer test. Option C is incorrect because bypassing storage does not exempt the cycle from rigorous tracking. It would only be correct if discussing a non-critical workflow step. Option D is incorrect because documentation is mandatory for all cycles. It is correct only when specifying the absolute requirement of a biological indicator exclusively for implant loads. Concept extension. If a patient develops a surgical site infection, proper documentation ensures the facility can trace the exact instrument and confirm that the IUSS parameters, e.g., 270F for 3 minutes, were successfully met. Question 2. A circulating nurse brings a contaminated bone rongeur to the substerile room and asks the technician to process it quickly via immediate use steam sterilization, IUSS, without manual brushing, to save time. What is the appropriate response? A. Proceed with the IUSS cycle if a 10-minute exposure at 270F is utilized. B. Rinse the device with sterile water before placing it in the sterilizer. C. Refuse the request, as all visible and non-visible bioburden must be removed per the manufacturer's instructions prior to sterilization. D. Wipe the instrument with a high-level disinfectant wipe before running the abbreviated steam cycle. Correct answer C. Knowledge point explanation. Core rationale. Cleaning is the essential first step in all reprocessing. You cannot sterilize what is not clean. All bioburden must be thoroughly removed following the manufacturer's instructions for use, IFU, before any immediate use steam sterilization, IUSS, cycle can be effective. Trap analysis. Option A is incorrect because extended exposure time cannot compensate for retained soil. It is correct only if discussing the standard extended cycle parameters for properly cleaned gravity loads. Option B is incorrect because sterile water rinsing does not remove embedded bioburden. It is correct only if discussing the final rinse step of a disinfection process. Option D is incorrect because wiping with a chemical does not replace manual cleaning and is incompatible with steam. It is correct only if performing environmental surface cleaning. Concept extension. Steam cannot penetrate blood, bone, or tissue. If organic debris remains, microorganisms hidden beneath will survive the cycle, leading to sterilization failure and extreme risk to the patient. Question 3. While preparing a heavily soiled orthopedic drill for an immediate use steam sterilization, IUSS, cycle in the decontamination area, which of the following personal protective equipment, PPE, configurations is legally required? A. Standard examination gloves and a simple surgical mask. B. Heavy-duty utility gloves, fluid-resistant gown, eye protection, and a face mask. C. Heat-resistant gloves and a waterproof apron. D. No PPE is required if the device is immediately placed into an automated washer. Correct answer B. Knowledge point explanation. Core rationale. Although immediate use steam sterilization, IUSS, is an expedited sterilization process, its prerequisite is thorough cleaning. When cleaning contaminated items in the decontamination area, full personal protective equipment, PPE, is always legally required per Occupational Safety and Health Administration, OSHA, regulations to protect the technician from bloodborne pathogens. Trap analysis. Option A is incorrect because standard gloves and masks do not protect against fluid splashes or sharps during decontamination. This is correct only if handling clean, sterilized packages. Option C is incorrect because heat-resistant gloves are used for unloading sterilizers, not for the decontamination cleaning phase. It is correct only post-cycle. Option D is incorrect because loading an automated washer still exposes the technician to contaminated items. It is correct only if the technician is working entirely on the clean assembly side. Concept extension. Full PPE creates a critical barrier. Missing even one component, like eye protection, violates safety protocols, regardless of how quickly the item needs to be turned around for the operating room. Question 4. During a supply shortage, an operating room manager suggests using immediate use steam sterilization, IUSS, to reprocess a batch of single-use plastic trocars. Why is this practice strictly prohibited? A. Single-use devices lack the necessary packaging to maintain sterility after an IUSS cycle. B. Single-use devices are explicitly not designed or validated by the manufacturer to be reprocessed by a healthcare facility. C. The plastic material will melt and permanently damage the sterilizer chamber drain. D. IUSS cycles require a 30-minute drying phase that degrades the plastic polymers. Correct answer B. Knowledge point explanation. Core rationale. Single-use items, SUIs, are engineered for a single application and are never designed to be cleaned or sterilized by a healthcare facility. Immediate use steam sterilization, IUSS, is exclusively reserved for validated, reusable instruments in urgent situations. Trap analysis. Option A is incorrect because the root issue is the device's inability to be reprocessed at all, not its packaging status. It is correct only when explaining why reusable items cannot be stored post-IUSS. Option C is incorrect because while melting is a possibility, the foundational violation is defying the manufacturer's single-use designation. It is correct only if explicitly assessing the temperature rating of non-medical plastics. Option D is incorrect because IUSS specifically omits the drying phase. It is correct only if discussing standard terminal sterilization parameters. Concept extension. Processing single-use devices carries severe legal and patient safety risks, including the inability to remove microscopic debris from uncleanable crevices and the structural failure of the device during a procedure. Question 5A. Craniotomy set is flagged for suspected Creutzfeldt-Jakob disease, CJD, contamination. The surgical schedule is heavily booked, and the charge nurse requests a rapid turnover using immediate use steam sterilization, IUSS. What is the specific protocol for this situation? A. Process the instruments at 275 F for 18 minutes using an IUSS pre-vacuum cycle. B. Standard IUSS cycles are not validated for and are insufficient for prion, making this request prohibited. C. Soak the instruments in a glutaraldehyde solution for 45 minutes before running the IUSS cycle. D. Run the set through 2 consecutive 4-minute IUSS cycles to ensure complete lethality. Correct answer B. Knowledge point explanation. Core rationale. Instruments used on patients with confirmed or suspected Creutzfeldt-Jakob disease, CJD, or prion risk require specific, extended terminal sterilization cycles as defined by the Association for the Advancement of Medical Instrumentation, AAMI, and the World Health Organization, WHO. Immediate use steam sterilization, IUSS, cycles are insufficient and strictly prohibited for deactivating prion. Trap analysis. Option A is incorrect because an 18-minute cycle is a terminal cycle parameter for prion, which contradicts the rapid nature of an IUSS cycle without packaging. It is correct only when performing a terminal, wrapped prion cycle. Option C is incorrect because glutaraldehyde does not deactivate prion and fixes proteins to the device. It is correct only if performing high-level disinfection, HLD, on standard semi-critical items. Option D is incorrect because back-to-back abbreviated cycles do not compound to achieve prion lethality. It is correct only if running multiple cycles strictly for sterilizer qualification testing. Concept extension. Prion are abnormally folded proteins that are highly resistant to standard chemical and thermal decontamination. They require heavy-duty protocols, often involving 1m sodium hydroxide or extended steam cycles like 273F, 134C, for 18 minutes in a wrapped state. Question 6. A surgical center scheduled 8 consecutive orthopedic cases but only purchased 3 sets of basic drill batteries. The supervisor instructs the technician to routinely utilize immediate-use steam sterilization, IUSS, between cases to turn the batteries over quickly. According to the Association for the Advancement of Medical Instrumentation, AAMI, standards, how should this instruction be evaluated? A. It is an acceptable practice if a Class 5 chemical integrator is included in every container. B. It is an acceptable practice provided the IUSS cycle logs are reviewed weekly by the infection control officer. C. It is a strict violation because IUSS must never be utilized to compensate for insufficient instrument inventory. D. It is a strict violation because power equipment can only be processed using low-temperature gas plasma. Correct answer C. Knowledge point explanation. Core rationale. AAMI standards explicitly state that IUSS should not be used as a replacement for sufficient instrument inventory. It is intended strictly for unexpected, emergency situations, e.g., a dropped instrument, not for routine daily turnover convenience. Trap analysis. Option A is incorrect because adding a monitor does not justify the inappropriate indication for IUSS. It is correct only when describing the monitoring requirement for a legitimate emergency IUSS cycle. Option B is incorrect because routine use for inventory is always a violation regardless of audit frequency. It is correct only when discussing general record-keeping audits. Option D is incorrect because many power tools are validated for steam sterilization. It is correct only if the specific manufacturer prohibits steam entirely. Concept extension. Surveying agencies like the Joint Commission, TJC, specifically hunt for high IUSS rates as a red flag for poor facility purchasing and inventory management. Question 7. A surgeon drops a uniquely angled cardiovascular clamp. The technician checks the manufacturer's instructions for use, IFU, which lists parameters for a 270F terminal wrapped cycle with a 30-minute dry time, but the manual completely omits any mention of immediate use parameters. What is the correct action? A. Process the clamp using an IUSS cycle at 270F for 3 minutes, relying on standard hospital protocols for stainless steel. B. Refuse to process the device via IUSS because it is not permissible if the manufacturer's IFU does not explicitly include parameters for it. C. Process the clamp using an extended 10-minute gravity IUSS cycle to compensate for the missing manufacturer data. D. Process the clamp using liquid chemical sterilization, LCS, since steam parameters are unavailable for immediate use. Correct answer B. Knowledge point explanation. Core rationale. This is a critical regulatory and safety principle. If the device manufacturer's IFU does not provide specific, validated parameters for an IUSS cycle, it is not legally or clinically permissible to process the device using IUSS. Trap analysis. Option A is incorrect because hospital protocols cannot override a lack of manufacturer validation. It is correct only if the IFU specifically lists 270F/3 minute for IUSS. Option C is incorrect because users cannot guess or invent compensatory parameters. It is correct only if the IFU specifically dictates a 10-minute gravity cycle for a complex porous load. Option D is incorrect because switching modalities also requires IFU validation for LCS. It is correct only if the IFU explicitly directs the use of LCS. Concept extension. Using unvalidated sterilization parameters puts the patient at risk of infection or device failure, and the facility assumes total legal liability for going off-label. Question 8. In a rush to return a multi-part orthopedic reamer for an ongoing surgery, a nurse instructs the sterile processing technician to just flush the assembled device with sterile water before running the immediate use steam sterilization (IUSS) cycle. What is the correct protocol regarding item disassembly for point-of-use processing? A. The item must be fully disassembled according to its IFU prior to cleaning, as effective cleaning cannot occur otherwise. B. Disassembly is safely bypassed if the sterilizer utilizes a dynamic air removal pre-vacuum cycle capable of penetrating tight joints. C. The item must be disassembled only if the technician visually identifies gross bone or tissue lodged in the box locks. D. Disassembly is prohibited for IUSS because losing a small screw or spring during the emergency would cancel the surgery. Correct answer A. Knowledge point explanation. Core rationale: all items must be disassembled for cleaning according to their instructions for use, AFU, regardless of whether they are destined for immediate use or terminal sterilization. If not disassembled, bioburden remains hidden, and sterilization will fail. Trap analysis: option B is incorrect because vacuum cycles cannot penetrate physical soil barriers. It is correct only when describing the mechanical advantage of steam penetration on perfectly clean, assembled devices that have specific IFU approval to remain assembled. Option C is incorrect because microscopic, non-visible soil is equally dangerous. It is correct only if discussing the triage process at the exact point of use before transport. Option D is incorrect because safety overrides the fear of losing parts. It is correct only if discussing devices explicitly permanently riveted and non-disassemblable by design. Concept extension: no shortcuts rule. The immediate nature of IUSS applies strictly to the sterilization cycle itself, omission of drying time. It absolutely does not apply to the pre-cleaning or disassembly steps. Question 9. When performing point-of-use processing, such as IUSS or high-level disinfection, in a sub-sterile room, why is meticulous item preparation and cleaning considered equally critical, or arguably more so, compared to preparing items for standard terminal sterilization? A. Because sub-sterile rooms typically lack the specialized water purification systems found in the central decontamination department. B. Because the point-of-use process completely lacks the physical protection of external packaging, meaning any cleaning failure directly poses a severe risk to the patient. C. Because point-of-use sterilizers operate at significantly lower pressure thresholds, making them less lethal to vegetative bacteria. D. Because the items are transported over much longer distances after processing, increasing the risk of recontamination. Correct answer B. Knowledge point explanation. Core rationale: item preparation, thorough cleaning, is equally critical for point-of-use processing because the process lacks the long-term microbial barrier of packaging. Any retained soil or failure in the expedited process immediately and directly contacts the patient's surgical site. Trap analysis: option A is incorrect because while true that water systems vary, the critical reason centers on the immediate patient risk and lack of packaging, not just plumbing. It is correct only if discussing the challenges of setting up a new sub-sterile area. Option C is incorrect because IUSS operates at the identical or higher pressure/temperature, 270F 275F, as terminal cycles. It is correct only if describing low-temperature sterilization methods. Option D is incorrect because point-of-use items are transported shorter distances, often adjacent to the ore. It is correct only if describing the risks of off-site processing. Concept extension: terminal packs have wrappers or rigid containers that offer some leeway in handling and storage, but a flashed, unwrapped item provides zero margin for error regarding asepsis. Question 10. A sterile processing technician is assigned to perform high-level disinfection, HLD, on flexible endoscopes at the point of use in a busy gastroenterology clinic. What is the mandatory standard established by the Association for the Advancement of Medical Instrumentation, AAMI, regarding the documentation of these point-of-use procedures? A. Documentation is highly recommended but legally optional for high-level disinfection, as long as it is not a sterilization process. B. All items sterilized or high-level disinfected at the point of use must be carefully monitored and fully documented to ensure patient traceability. C. The technician only needs to document the minimum effective concentration, MEC, test result at the start of the morning shift. D. Full documentation is only required if the patient exhibits symptoms of an active hospital-acquired infection prior to the procedure. Correct answer B. Knowledge point explanation. Core Rationale. AAMI standards require full monitoring and complete documentation for all sterilization and high-level disinfection cycles, regardless of whether they occur in the central department or at the point of use. This is non-negotiable to ensure process quality control and enable patient traceability in the event of an outbreak. Trap analysis. Option A is incorrect because HLD documentation is strictly mandatory, not optional. It is correct only if describing non-critical surface sanitation logs. Option C is incorrect because MEC testing must be documented for every single cycle/patient, not just once a shift. It is correct only if discussing daily sterilizer diagnostic tests like the Bowie-Dick. Option D is incorrect because universal tracking applies to all patients. It is correct only when discussing specific post-exposure prophylactic reporting. Concept extension. The log must include patient name, medical record number, specific device identifier, processing parameters, and the technician's signature.